Preeti and you're watching Med Resolution. In this video, I'll be teaching you about the pectoralis minor muscle, which has been asked as a 5-mark question. They ask you about the attachments, nerve supply and actions. I'll be discussing all of these in this video, which is a RS. It has been asked in the revised syllabus 3, that is RS3. Introduction. This is a small muscle. As you can see, this is a small and triangular muscle. This is a small and triangular muscle. This is a triangular in shape and small muscle. It lies deep to pectoralis major muscle. If we think this is as a pectoralis major muscle, this hand is pectoralis major muscle, this lies deep to pectoralis major muscle, that is, it lies deep to pectoralis major muscle. This is a pectoralis minor muscle. Origin, it originates from 3rd, 4th and 5th ribs near the costal cartilage. This line represents the junction between the cartilage and bone. This is a costal cartilage. We call the cartilage in the ribs as costal cartilage. Near the costal cartilage, in the 3rd, 4th and 5th ribs, it takes origin. This is the first rib. Here you can see this above will be the first rib at the sternal angle second. This is the 3rd rib, 4th rib, this is the 5th rib. It takes origin near the 3rd, 4th and 5th, near the costal cartilage, that is 3rd rib, 4th rib and 5th rib. And then it is inserted as a thick tendon. It forms a tendon. Tendon is a fibrous connective tissue which will be thick near the medial border on the coracoid process, on the upper surface of the coracoid process. This is a coracoid process. To the medial border, it goes and inserts. It inserts in the medial border of the coracoid process on the upper surface. This is the upper surface, this is lower surface, upper surface, it goes and inserts. And nerve supply will be both pectoralis major muscle and minor muscle has been supplied by lateral and medial pectoral nerve. Lateral pectoral nerve root value C5, C6 and C7, whereas medial pectoral nerve root value C8 and T1. So it forms all the segments of the brachial plexus. Action, it depresses the shoulder. It depresses the shoulder. If we take this as a shoulder joint, it depresses the shoulder by depressing this coracoid process. It is an accessory muscle in inspiration. During forced inspiration, this muscle helps in inspiration. Normal inspiration, this diaphragm and external intercostal muscles helps in normal inspiration, whereas in a forced inspiration, pectoralis minor muscle also helps in forced inspiration. It assists serratus anterior for protraction of scapula. If this is a scapula and this is a chest wall, it helps in protraction. This is retraction, means like going away from the chest wall. It helps in protraction of the scapula. And note, pectoralis minor muscle is a key muscle of the axilla. Because why we say key muscle means with reference to that we discuss something. So this is a key muscle of the axilla. Because it divides the axillary artery. See, this is axillary artery. After crossing the lower border of the first rib, we call the subclavian artery as axillary artery. The continuation of subclavian artery is the axillary artery. After crossing the lower border of a teres major muscle, it continues as brachial artery. So this part is the axillary artery. As pectoralis minor muscle passes on the axillary artery, it divides axillary artery into 3 parts. First part, which will be proximal to pectoralis minor muscle. Second part, which will be deep to pectoralis minor muscle. And third part, which will be distal to pectoralis minor muscle. Thank you. That's all for this video.